So my name is V Nguyen. I am from the AAP, and I have been doing climate and health advocacy for about 4 years now. And so I think all of us have an aha moment. Maybe today is one of your aha moments when you realize it is an existential crisis and you kind of have to do everything you can to preserve some semblance of quality of life for our next generations. And so what happens when you hit that existential crisis? You reach out to friends. And I am so honored to introduce my good friend, Dr. Luis Castellanos. We actually are medical school classmates. We were actually in patient doctor 1 together. If you remember, first year medical students taking the green line over to the VA and learning basic medical examination skills. And so Luis is not only a good friend, and I actually was reading your CV and I have a little bit of envy. I'm going to try to up one, you know me, I'm like typical Harvard person. I got to be like a little bit competitive. And so, Luis is, executive director of the, Prime HEQ Health Equity Cluster here. He's a professor of clinical medicine at the medical school. And he is definitely, graduated summa cum laude from UC Davis. And I just joke around. It's true. If you went to Harvard College and went to Harvard Medical School, it's not that hard to get in. If you went to UC, you had to be the top 2 kids at the UC campus. So he's super smart. So when I met him in undergraduate, I thought to myself, dude, you're really smart. And he, so went to Harvard and then came back here to San Diego for residency, went back to Harvard for his MPH and then did his fellowship in cardiology at UC Davis. So in general, well-published, well-respected, well-loved, especially by me. So please give it up to my good friend and partner in crime, Luis.
That's an amazing introduction, I have to say. Yeah, I'd like to say that V is an amazing person, but an amazing just clinician. In fact, she's the pediatrician for my kids, and that's how we reconnected. Just took my kids to Kaiser, and I saw her name. I was like, this can't be the same V from patient-doctor interactions at HMS, and it was. So she's been fantastic, a great partner in crime here. All right, so we'll get started. All right, so anyway, so I wanted to actually include this slide for 2 reasons. Number one, I don't have any financial disclosures for the material I'm going to present, but I do have a conflict based on the information that we're talking about because it's very dear to my heart. This is a picture of my 3 boys, my 3 kids. We were actually walking down the beach between Encinitas and Carlsbad during one of the days, and I decided to take a picture of them. They're young, oldest 11, followed by 9 years old, and the youngest is 7. And the reason I feel very passionate about coming and speaking to all of you and working on these issues related to heat, extreme temperatures, climate change is because of them. Is because I want to leave behind a world that is better than when I came in. So again, that's the reason I'm doing this. The other reason that I wanted to be here today is because we have an amazing group of individuals here in San Diego that are working on climate change, and heat and extreme temperatures. And these are actually the images of an article that was published a few weeks ago, and it's all driven by Dr. Nguyen as well as Mary Lou and Kristen. I don't know if they're here today, but oh yeah, there you go on the back. Awesome, thank you for helping put these things together. Published on the San Diego Union Tribune, July 17th, and it really encapsulated many of the things that we're talking about today. The fact that it's very important to educate the public, educate our colleagues or students that we got to do something about extreme temperatures and the amount of just consecutive days of high temperatures here in San Diego and in our communities. Now, why is that important? Because it affects the entire nation. It also affects regionally. These are a couple of 3 pictures that I took during our recent trip that I took my boys to Yosemite. I grew up in Northern California, a small town, Modesto, California. Some of you may be familiar with the area. It's about 90 minutes from Yosemite. I had the privilege of going to Yosemite on a regular basis and just seeing just the beautiful nature, the sequoia giant trees, the valleys, Half Dome, the waterfalls. My wife will attest that for the last 5 to 6 years, I've been meaning to take the family so they could see some of the things that I witnessed, that I experienced when I went there. But I was not able to do that because of all the fires, the excessive smoke that surrounded the park, the valley. And I just did not want to put my family through that. And now with COVID, same thing. A lot of these areas were closed. Finally, we got a chance to go there. And here it highlights Yosemite Valley. We got one of the giant sequoias and the entrance to the park. The trip ended up putting things into focus for me in the sense that we have to work collectively, we have to work together, we need to be aggressive about making some of these changes, both at a national, state, and regional level. And that is important because it not only affects us, but it's affecting many, many other areas. I just took a couple of snapshots that came through my news feeds on my phone about what's happening in other parts of the world, right? We're talking about Europe, we're talking about Italy, we're talking about Australia having fires, Canada having those fires, and the smoke spreading throughout the East Coast. And now, unfortunately, we have our brothers and sisters from Hawaii, Maui, getting affected dramatically. So this is an existential threat, and we need to do something about it. We know based on the heat maps that were shown by our good friend and colleague, Alexander Tardy, that the temperatures are getting warmer, getting hotter locally, regionally. And in fact, here you can see in Phoenix, Arizona, they've been having the highest number of days, consecutive days with more than 110 degrees Celsius. When I took this snapshot, when I was working on my presentation around mid-July, it was the count was up to 19 straight days. I just checked recently, and they're up to 40 days straight of 110 degrees or more. So it's something that we need to think about. Now, it's affecting our communities. All right. So these are snapshots that I took of Yosemite Park, and you could see that in this area right here, you could see that the trees getting all burned up right there. So as you guys were probably familiar, over the last couple of years, parts of the park have been burnt from wildfires. And it's important to recognize that this is what it's supposed to look like right here. The big sequoia trees, beautiful canopy protecting our environment, which, by the way, this is actually at a higher altitude. It's about 5,000 to 6,000 feet above sea level. So if you plan to take the trip and do some hikes there, you got to make sure you're in shape. And I'd say that because I don't know if the people maybe sitting on the front, you can actually see this young person right here, all right, telling me, no more, no mas, I'm not going any further. That just happened to be my wife, said, no, I'm not hiking any further than that. So I took a picture of her, at least to prove that she actually did make the trip out there and was willing to spend some time with nature. Now, but in all seriousness, again, seeing these sites of parts of the park getting burnt made me sad, but also even more committed to our cause that we got to make some changes. All right, so how is this all interconnected? Well, we got to think about the climate drivers that are producing some of these issues, also heat and air pollution, in particular, fine particulate matter that can affect this. And then you add the component of our patients. Many of our patients, that was mentioned by Dr. Kalak, have comorbidities. They could have diabetes, have underlying cardiovascular or pulmonary conditions, kidney disease. You put all those things together in addition to specific groups or categories of patients, those individuals that are more vulnerable, right, such as the elderly, the young patients, those individuals who work in extreme temperatures, and people from lower income who may not be able to afford having an air conditioner or a fan. So when you combine all these elements, the drivers, the air pollution, the excessive heat and the heat waves in conjunction with the social and the economic factors that some of them may not necessarily have the income to actually afford air conditioner or even a fan, then you end up having bad outcomes. Bad outcomes in the sense that they come out into the emergency department because they end up having illnesses that affect the kidneys, the vascular system, their heart and lungs. All right, I want to actually highlight this particular article. It's a meta-analysis that ended up doing a review of the literature and included over 260 articles, and it ended up by showing that if you end up increasing the temperature by 1 degree Celsius, that will increase the mortality rate for those individuals. And although the percentage may not be too high, 2.1% or so, when you look at it from the perspective of the population, when you talk about millions, it could end up having a significant effect. Also, if you increase the temperature by 1 degree Celsius, that also increases cardiovascular morbidities. And we talked about cardiac arrhythmias like atrial fibrillation, atrial flutter, other arrhythmias like that. It also ends up increasing cardiac arrest and coronary heart disease in the form of angina, myocardial infarcts. So it's important to recognize those things. And as I highlighted before, there's certain groups that tend to be more affected than others, such as individuals that are older, above the age of 65, also individuals who end up living in areas that have lower income, and women as well. Now, let's bring all this locally. How does this affect individuals here in Southern California, in particular, San Diego County and Imperial County? And I wanted to bring this to the attention of all of you because the Salton Sea is an inland body of water that was basically as a result of overflooding from the Colorado River. However, with the development of dams and reallocation of water for agricultural areas, much of that water that used to flow into the Salton Sea doesn't go there anymore. So in fact, for many years, we've dealt with the issue that the Salton Sea is actually shrinking. And that is a problem because it lays right here between Imperial County and Riverside County. And that's an area that actually heavily impoverished. As many of you may remember from a couple of years ago, COVID ended up devastating this area because there was many needs to provide services to the individuals in both Imperial and Riverside County. Now, I wanted to highlight this because over the last 2 decades or so, and this particular study that looked at the information from 1998 until 2014, you could see based on the dark black line that over time, the size of the lake actually has gone down. And in an inverse relationship, you see that as the size of the lake goes down, the amount of fine particulate matter less than 2.5 microns is the increase. So that basically tells you that there's actually more pollution in the air surrounding that area. Now, as you have stronger winds, the Santa winds, right? We usually experience those here in San Diego, coming east to west. That picks up a lot of that fine particulate matter and brings it to our area, and then you start breathing it. How does that relation occurs? Well, with one foot drop in the lake elevation, you end up seeing a decrease of 2.6 increase in fine particulate matter in the air. So more pollution. That leads to higher cardiovascular mortality events, as well as higher health costs to the individuals who live in the area, as well as to all of us, because we're paying for the healthcare that is being provided to those individuals. Now, I wanted to briefly highlight the issue with vulnerable populations. As Dr. Kalik mentioned, there's some groups that tend to be more affected than others, such as children, the elderly, communities of color, as well as low-income communities. But it's important to highlight there's other groups as well, such as those individuals who work in extreme temperatures, such as farm workers, individuals who end up having to do constructions, work on the roads. They're exposed to the asphalt, right? What we call the concrete exposure. They don't have shades or canopies to protect themselves from extreme temperatures. So we have to be cognizant of all those populations. And obviously the homeless population as well. All right, actionable solutions. Let's talk about what we can do. Dr. Wooten was able to highlight today and her team about cool zones and the resources that are available. It's important to highlight, and I stayed afterwards to talk to them about this, that they do have the mechanism to actually transmit this information to different populations in multiple languages. San Diego is a very diverse county with people who speak multiple languages, different cultures. So they do have the resources to communicate to them that, hey, you know what, during an extreme heat warning, you can go to a cool zone, which it could be a library, it could be a rec center, it could be some other community center or a mall. So you can end up getting some relief from the excessive heat. It's also important to highlight that we got to do something about this fine particulate matter that is in the air, or the pollution. That's what's really going to be driving synergistically with the heat, the higher comorbidities and cardiovascular conditions that I talked about. So one of the ways that you could do that is actually by refilling up the lake. When you actually put more water into the Salton Sea, then the sediment will actually get buried in the bottom, and it's less likely to be picked up by the wind, and then you end up breathing it in. So actually, there's a double effect, not only for humans, but also for the birds that end up doing the migration to other areas. So repopulating the lake, it's important. And then the last couple of items that I wanted to highlight that has been so far has been mentioned throughout the talks here is advocacy, right? Dr. Adam mentioned how important it is to actually make your voices be heard and speak with your local leaders, state representatives, to actually combine together. We can make a huge impact so that we can educate not only politicians and our colleagues, but also the youth, so they can actually help us move things forward. And then finally, a reduction in greenhouse emissions. It's we've been lucky that here in California, there's been multiple programs in order to electrify homes and provide actually rebates so you can get solar installed and changing your gas stoves into an electric stoves, and in the implementation of heat pumps as well. All right, so we talked about actionable solutions, protecting green spaces. Let's make sure that we actually protect our forests, or oceans, or beaches, and our communities, so that we can actually have a better environment for our kids and for community members. And I wanted to introduce this last slide again, because none of this would have been possible without the support of everyone working behind the scenes. And in particular, we have our amazing medical students here, said on the back again, for all the work they've been doing. Dr. Jones, Rosie, and Dr. Bailey again for making all this possible. And I leave you with my favorite quote that I picked up when I was reading the books with my kids from the Lorax. Many of you may be familiar with it, that unless someone like you cares a whole awful lot, nothing's going to get better. It's not. Thank you for your time.